All right. Good afternoon, everybody. I'm just going to mute everybody from now. All right. So good afternoon, everybody. Thank you again for being here today for our second edition of the Thrive series. Again, I know that we have most people here from before, but I'm just going to go over some of the ground rules for anybody who might be new and didn't come last week. So the first thing is for everybody, please to turn your video off so that we don't have as much bandwidth being used for this session. And well, I just muted everybody's mics, and I'll unmute you if you have a question or anything like that, just so that we have no unforeseen incidents happening. I am recording this session. I'm not really planning to use it. I'm just recording it for my own purposes. But if I do use it later on, I'm gonna obscure any faces or names or anything like that so that we don't release anybody's information. And on that note, we are also trying to keep this a nice safe space. So if there's any information that's shared in the group that might be personal, just keep it confidential, please, especially with regard to names. If you have questions, you can post it in the chat. You can either, is everybody else hearing me? Yeah, okay. If you have questions, you can post it in the chat. You can either post it to me privately, or you can, post it in the main chat. Somebody else might have the same question. And also, if you want to wait until the question and answer session, feel free to do that too. All right, so that's the ground rules done. And yes, for every session, I will have to say those kind of ground rules, but I'll try and keep it short every week. All right, my name is Aaliyah Drakes. For those of you who don't know me, I am a children's occupational therapist, and I'm also the director of Opal Kids. I am the host for all of these sessions, and fortunately, my hard part was done last week. So for the rest of these sessions, I'm just hosting and interacting with the guests. They are the stars for the next few weeks. All right. So for going forward, we spoke about occupational therapy last week. And now that we are moving on to other professions, I wanted to do things a little bit differently for the rest of these sessions. And for every week, have a little highlight before we start. So for this week, I want to highlight the multidisciplinary team. Now, as we start to chat with everybody else, speech therapists, Dr. Bratt is a pediatrician, etc., I just want to impress upon the importance of having that multidisciplinary team for yourself and for your family. Now, a lot of us occupational therapists work with other professionals. We might, share an office with speech therapists, mental health professional, behavioral specialists, that kind of thing. And mostly we have a good relationship with each other, so we could share information as needed. And even though we might not be in the same office, or we have our different practices, for the most part, where the parents consent, we would send an email or WhatsApp or something to share information. Now, I will admit that it's not always how it should be, in that even though we might know what everybody else is doing, it might not always be in a nice, holistic way. And I think for me, that's one of the things that I want to do better, is making sure that I contact the rest of the therapists more, so we have a nice, holistic approach. But for the most part, it is very important that everybody knows what everybody else is doing, so that we can share information, and so that we can make sure that everything that we are doing is aligned to benefit you and to benefit your child. Now, one of the things, I know that sometimes it might look like if we're doing the same thing. So for example, if the speech therapist is doing Play-Doh and then I am doing Play-Doh, you might be thinking, well, why y'all only playing with Play-Doh? How come the two of you are playing with Play-Doh? What's that about? But our focus might be different. So as an example, a few years ago, I was working in St. Lucia, doing some work with a clinic over there. And for one of these sessions, we had, it was myself as the OT, a speech therapist, and the physiotherapist. All three of us were with the parent and the child for 1 hour in the session. And all of us got to do our little activities with the child and got to talk to the parent. But afterwards, I was reading the notes. I was putting my notes at last. And when you looked at the notes, it looked like it was 3 completely different sessions. Because even though whatever the child was doing, I would have been looking at maybe the fine motor skills and the sensory skills and, you know, checking their independence, while the speech therapist is looking at how they're communicating or if they're using language. And then the physio is looking at balance and posture while the child is doing the same activity. So all of us might have a different focus. And that's why it's important that we all work together to make sure that, you know, we are following the same kind of path. But having said that, the main thing that I want to stress today is that even though we will have this multidisciplinary team, you as the parent, you are the center of that team, and you are for sure the most important part of that team. Because while we might be the experts in the conditions and whatever the special need is, and knowing, you know, what therapy to do and how to change it up to meet the needs of the child, you are the expert in your child. So you are the one who really has to take charge and say, well, you know, that might work or it might not work, and you're the one who really has to advocate for your child. So I just want to kind of make sure and stress that you are the leader of this whole multidisciplinary team. And, you know, don't forget that. Don't forget to ask your questions. If you have to, voice your concerns and you know, just try to get your answers as much as possible for your child. And don't be afraid to do that. Right. So that's my little highlight for today, just about that multidisciplinary team aspect and how important it is. I just want to jump right into today's guest. As you know, today's guest is Dr. Bratt. He is a well-renowned pediatrician here in TNT. He was born in Woodbrook. He is married with 3 children. He has his medical degree from Central University of Venezuela, and he has done his pediatric training in Baltimore, USA. He is American board certified. He has his master's in public health from Johns Hopkins University, and he's a former senior lecturer in child health at UWI. And his interests are children, obviously, but also cricket and calypso. Now, that was the bio that Dr. Bratt gave me, but he either forgot or he did not mention one very important part, which is that he's also an author. He's written a book called Book of Bratt, Bringing Up Children in the Caribbean, and he also writes very, very meaningful blogs on his Facebook page. So I'd encourage you all to, you know, check that out, because everything that he writes is always like, yeah, it's kind of exactly what you're thinking, and you kind of want somebody to say it. And he says it, and he's unapologetic about it, and I really appreciate that. So let me just unmute him now. So welcome, Dr. Bratt. Thank you so much for joining us today and, you know, being here to share your expertise with us. I really, really, really appreciate it. All right.
Thank you, Aliyah.
You're welcome.
How are we going to do this?
All right, so I know at first, I have some questions that I want you to ask, but I know one of the things that we were talking about back and forth in our email conversations was about development and that first year of development. So first we could kind of go into the first year of development and some of the things that are, I guess, some of the key points of that first year.
So let's just make sure everybody understands what development is all about.
Right.
It's different to growth, because growth is an increase in size of the child, but development is an increase in function.
Okay.
What the child does. And the whole aim of development for a child is to become a competent adult. And if things don't go correctly, then you end up with adults who have problems.
Right.
So the thing about development is that it's supposed to go through an orderly process according to the age of the child. So that at 1 month or 2 months or 3 months or 5 months or 7 months or 1 year, 2 years, 3 years, the child is supposed to be doing certain things. And by and large, that is how it goes. And if it were that alone, it would be very easy to decide if a child is developing well. You just look at it and see if the child is doing what it's supposed to be doing. The problem is with development is that it's very irregular and it's different in each individual child. So that a child at 9 months may be doing something that another child doesn't do until 12 months, and yet it's very normal. So there's a
Like
wide
walking.
range of what is considered normal. What this means, one, it confuses parents because they don't know this child is doing something and my child is not doing it, and is that normal? And two, it's very easy to make a mistake, a pediatrician or a developmental specialist to make a mistake and say something is correct when it's not correct, or something is not correct when it is correct. So people need to keep that in the back of your mind. It's very, very difficult, and it's not very nice for parents, because a lot of the time you don't know exactly what is happening or what is wrong with the child. Which brings up your point, by the way, which is the multidisciplinary approach. And I believe in that totally, because you know much more than me about child development. You know, a speech therapist knows much more than me about speech development.
Right.
So that in the beginning, however, I think it's important that if you suspect something is wrong with your child, as far as the development is concerned, you go to a pediatrician. Because the pediatrician probably should be first one, because there are many different causes, and some of them could be something's wrong with the heart, something's wrong with the brain, something's wrong with the eyes, something wrong with the ears, something wrong with the thyroid gland, something wrong with the child's environment. And depending on what is wrong, then you direct the person towards the appropriate specialty, whatever that is. And as you yourself say, it may be 3 different specialties or that, that the child is going to need at some point in time.
True. But the pediatrician is stop number 1.
I think so. I think because
so too.
It may not be just a simple developmental problem. It may actually be a physical problem, an illness. A child with sickle cell disease, a child with cerebral palsy, a lot of different things can cause a child not to develop well. So that's probably where you should start.
I think it's important to rule out any medical things first.
Yes, that's
then you get to development afterwards.
That's it. That's it. That's it.
I agree. All right. So one of the things is in terms of diagnosis. One of the things that we were talking about back and forth was getting an early diagnosis or as early as possible and not waiting. I know one of the things was, I saw it in a page recently where people were saying, no, wait and see, because I think the child wasn't talking or something like that. And as I was telling another parent and telling you, reading that and knowing to myself, you know, that's not what you should do. I didn't want to jump in and say anything, but it's something that you see a lot happening where a lot of people is like, nah, wait and see, might be a late talker, might be a late bloomer. So in terms of making a diagnosis, how early would you think a parent should, you know, come to you with their concerns, especially what you just said about some children might be, you know, walking at 9 months while some might be at 12 months, and that's completely normal.
Yeah. So we should need to get that out of the way. This business of waiting.
Wait and see.
Yeah. No. If it's one thing people need to take away, is don't wait and see. This is a place where it's better to be safe than sorry. And the thing is, there are three things about making the diagnosis. First of all, it's so difficult because, as I said, things change. And you may have a child who is 17 months old and not walking, and you're getting scared. And then in 2 weeks' time, the child starts to walk. And not only walk, runs. So things can happen. Things can happen very quickly. So parents know this, so they tend to say, well, let's wait because it might get better. But the second problem with waiting is that the earlier you make the diagnosis, the easier it is to treat the child. So if you have a child that is 18 months old and the parents suspect the child is not reacting socially appropriately, not as friendly as you think the child should be, it's better to go to someone, get an idea if something is wrong, start treatment at 18 months rather than wait until 3 years and then start treatment. The younger the child, the younger the brain, the easier it is to change things around in that brain. And then the third thing is that, again, it's not easy to make a diagnosis, and often the pediatrician won't be able to make a diagnosis in one visit. And that's really important because people think, well, we're going to the doctor and he's going to be able to tell us right away as soon as he sees the child, he knows what's wrong and tell us what the diagnosis is. Life and medicine is not like that. This is a difficult subject and it may take repeated visits. And people sometimes wonder, well, why do I have to go back? I have to go back because I'm not sure. I remember years ago, we were learning about a disease called juvenile rheumatoid arthritis. Rare disease. And I was at Hopkins and I was in the juvenile rheumatoid arthritis clinic. And they told me it took them 6 months and on the average to make a diagnosis of juvenile rheumatoid arthritis.
Wow.
This was state of the art, the best in the world. And yet it takes them 6 months. Now that is one example. The same thing can happen with a child who's not developing appropriately. It's sometimes important not only to see the child at one point in time, but over a period of time. You get a better idea of how the child is developing before you say something. And then of course the other thing is you bring in other specialists in the area who are involved and you work as a team talking to each other about that. That is key. That is so important. And it's a kind of a new concept in Trinidad. We've been doing it, when I say we, and a couple of other people have been doing it for the last 30 years or so. But people don't understand why you have to go and see the occupational therapist, why you have to go to the physiotherapist, why you need the hearing test. All of these things, you need a proper assessment to get a proper diagnosis and a proper treatment.
I think, and one of the parents I think is asking about why she didn't get a diagnosis of autism then. And I think that might be one of the reasons why is that it's not as easy to just say, right, your child has autism. Because I know for me, I would see many children, and even though I might think autism, there's still some children I see where I'm like, I'm really not sure, even though I've been seeing them for a while. There's so many different things you have to rule out first that, I mean, I am not qualified to rule it out. So I can't say that, well, I can't diagnose anybody anyway. But because there's so many things going into play there, it's not for me to just look and say, well, right, your child has autism, this, that, and the next one. Right. So it's very important, as you say, to make sure that everybody gets to see the child and everybody has their say so that you can rule out and rule out and rule out and then make sure to get the diagnosis.
It's important to point out that I see a lot of kids with developmental problems, but that's maybe 5 to 10% of what I see. And we really need a center in Trinidad where there are people who all they do is see children with developmental problems.
Correct. Totally agree.
Families in Action the late Ivis Gibson, myself, psychologists, a number of other people have been agitating for this since 2004 because it's so badly needed. Where you think something is wrong with your child, you can go there and get evaluated, and such an evaluation may take a whole day. And at the end of that time, at least you have a better, you see the pediatrician, you see the development specialist, you see the neurologist, you see the occupational therapist, the audiologist, you see the social worker, the special ed teacher, the physiotherapist, everybody. And at the end of the day, everybody gets together as a team and comes up and discusses the child over 1 hour, and we come up with a plan of action, a medical plan and an educational plan. And we really need that badly, badly in the country. And it's not something that can be done privately because
agreed. That's too much money.
Too much money.
Yeah.
We have priced it out. It'll take $10–12 million a year to run it.
Yeah, that
kind of money. Even if you go to United Way or you go to local companies, they'll say yes, we like the idea, but government has to come in. It has to be a private public sector move.
I know it could get very political and that kind of thing, talking about development and these centers and that kind of thing, because we know that all of these services, most of them are not available publicly, especially the therapies. And because of that, that's why there's so much of the wait-and-see. As one parent here is saying now that, you know, you want to do things early, but by the time you get the appointment, you have a waiting list for another year or however long. And then if something happens like COVID and you miss the appointment, then it goes on to having to wait longer.
There's a very good letter in today's Express, by the way, from Dr. Balderson.
Psychologist. Oh, okay.
He's a developmental pediatrician in South. And everybody should take a look at that because that's out there exactly, more or less what I have just said, but in a better way, what is needed in the country. For example, we have no occupational therapists in the public sector.
Exactly.
No occupational therapists in the public sector. We haven't had a speech therapist in the public sector since Stephanie Hospitalis died in about 1981 or 1982. And not only children need speech therapists, but with strokes need speech therapists to learn how to speak again. And we have none. So those are some of the, yes, Dr. Bahadusin shared it. Those are some of the things that we need. I'll
find the link to that because he have it on his Facebook. So I'll find that link and put it in the email to everybody so that everybody can go and read it. One of the things that you had mentioned was talking about denial.
Yes.
Now I know that this is a touchy subject, but it is one that we should discuss because it's very important.
Yeah. Well, it's getting into the psychology now of parents' behavior and medical behavior, because pediatricians, doctors also deny that something is wrong. It's not nice to have to tell somebody, your child has so-and-so, and when they need a special school, and I can't tell you what sort of adult that child is going to be. That is really difficult.
Correct.
You want to be very sure, and it's much easier to say, well, let's wait, especially since you know that things can change very quickly. And then, of course, on the part of the parents, it's another problem. Nobody wants to know that something is wrong, and that's normal. That's normal. So most people are in denial the first time they are told anything. Unfortunately, they don't come back, and they don't come back for years. And then that is a problem when they start going to school, because when they go to school, now it's the teacher who has to tell them that something is wrong. And teachers really have a hard time with that, because again, to be told that something is wrong. And then, so it is a huge problem that people just need to know about. It's normal. You have to deal with it. And there's nothing wrong in saying, look, I'm going away. I'm going to think about it. I'm going to talk to my family. I'm going to consult another doctor. I'll get another opinion, and then I will tell you what we're going to do.
As you said exactly, there a lot of times I deal with a lot of parents who might be in denial or just not ready yet to accept that these are all the things that you're gonna have to do differently from what you thought. And I always same thing. I always say, you know what? When the child starts school, or at least, or if the child is already in school, when it gets up to kind of SEA time or time when school gets a little bit more difficult, that's when we kind of see them coming back. And but that's why, and there's just a thing for next week, these sessions that we will have with the psychologists. These are some of the things that we're gonna touch on. There's one part for children and just helping them understand their diagnosis and to tell them, but then also for parents as well. There's a whole other part of denial, but I'm not ready to share that yet. More on a personal level.
Okay.
But
we want to go through some of the key developmental landmarks.
Yes.
We have life.
Yes. So let's look at just some of the things. I know we can't go through everything in one sitting, but
so some of the key things that the baby should be doing, which gives you a pretty good idea, if you want to call it a red flag, you know, to raise concern.
Right.
We're not going to talk about the baby at birth, about things that the baby should be doing. Just to remember that baby at birth can do a lot more than you think it can do. And that baby's brain is so ready, born ready to learn, that everything you do, everything, pulling the baby's ear, holding the baby a certain way, talking to the baby in a certain tone of voice, everything you do imprints on that baby's brain and creates a response of the baby's brain, which will help it to develop. So we have a little program going, which is starting. We call Let's Read. And one of the key things that help babies to develop is reading. Not too sure exactly what happens, but reading makes the brain powerful. Just reading to the baby from birth, or if you want, from inside the womb, because babies in the womb do a lot of things. Anyway, so your baby is born, and what I normally do, I see the baby at 2 months, 4 months, 6 months, 9 months, and 12 months for the first year. And that corresponds well to the time when the baby is supposed to get shots and so on. So at 2 months, the big key for a baby is the baby should be smiling. A baby who's not smiling at 2 months, could be a problem. I have seen normal babies who haven't smiled at 2 months, but I've seen about 2 in 40 years.
Okay.
All other babies are now smiling. I don't mean the smile that Trinidadians talk about, how when the angel passes, the gas smile. No, this is the smile. You look at the baby, you smile at the baby, and the baby smiles back. It's not talking to the baby. Not because the baby may smile. A blind baby will smile if its hearing is normal. So the baby has to look at you and smile. The other thing the baby has to do is follow you around the room. Follow you around the room. Those are 2 key things. And that's probably once you have a baby at 2 months who's smiling at you, a lot of things fall into place. Probably everything is going to be normal. Not all. Then at the 4-month visit, what I like to check is the baby's head control.
Right.
So that's motor. You know, development has various branches: motor, fine motor, language, social, and so on. The smiling and the cooing and following around, that's social. With motor, we divide all these things up into different branches, you know, but it's all one. Everything. The baby can't smile unless it can control his muscles.
Correct. Everything connected.
Everything is connected. Everything is connected. Unfortunately, we try to split things up too much. So at 4 months, the baby should be able to control its head. Well, that means, like today, they brought in a 4-month-old. The father is holding the baby, right? And the baby's head is stiff, straight up, looking around. a little, every now and then the head drops a little bit. That's what the baby should be doing. And your doctor should examine the baby, put the baby to lie down, take the baby's hands and bring the baby to a sitting up position. And you see some babies love to do that. They want to, some of them want to stand up. But that's all right. What you want is that head must be fixed, strong, turn around, look around, smile. Because at 4 months old, they're still smiling. At 6 months when they come back, they're no longer smiling. They're no longer smiling at strangers. So something is developed called, they're a little cautious now with strangers. Up to 4 months, a baby will smile at anybody. 5 months, 6 months, 7 months, now they have attached to one person, they're in love with one person, the mother or the caretaker or the father or the nanny or the granny or whoever it is. And they want that person by and large alone. And they don't want anybody else to come by. Not all babies are like that. Some babies are friendlier, and that's fine. But they also there should be a little hesitation on the part of the baby to go to you, or not like you to come and hold it. And that's important. Another thing that is important at that age is most babies, most Trinidadian babies seem to want to sit down or are sitting down or are beginning to sit down. Now, sit down doesn't mean the parents put the baby to sit down. Eh? I had to learn that. Sit down means the baby on its back rolls over and pushes. That is sitting down. So now the baby could sit down, right? And another interesting thing happens at that age now, the baby starts reaching and it wants to do things. So if you give the baby a brightly colored crayon or pencil, then the baby reaches for it and holds it. A 4-month-old can't do that. A 4-month-old will try to do it and it won't be able to do it. It will bat it around. But a 6-month-old baby does it. And the way it holds it like that. Can you see? Yeah. It uses this part of the hand to hold. And that's normal because at 9 months, the baby is going to use this part of the hand here to hold.
Okay.
And then at 1 year, it does this. It pins up. All right, and that is the progression of the grass. You know, you like this. That's the progression of the grass. Palma. This is the whatever side it's called.
Genital pronate.
Yes, and then the pincer. And so now you know that the baby's fine motor is good. And at 1 year, the baby usually is standing up, taking its first steps. At 1 year, is saying some words. And at 1 year, it can wave bye-bye or send kiss or give a 5. Social, fine motor, walking. Fine motor is the grass. Gross motor, standing up and walking and saying mama, milk, dog, sky, or something like that. And that's what we want to see. Kind of a smooth pattern from birth up to this 1-year-old.
Now, as you say that, as you're talking about development and everything with different age group, it kind of makes me think that I think even with children with special needs, it will follow a same kind of progression. Because even for children with cerebral palsy, we still, even though I might be working on the fine motor skills, I still need to do work on the gross motor skills to make sure that there's enough core stability and enough shoulder strength before I could even think about doing anything with the hands. Yeah. Much like a baby needs to learn how to roll over and sit down before they could learn to be able to grasp something properly.
Let's make sure the parents understand what you just said, because that is so important. Everything builds on everything else.
Correct. So, I mean, yeah, well, exactly that it starts from, because, well, when I learned it with more motor skills physiotherapy,
yeah,
you learn that you can't do things, all these fine movements with your hand, like handwriting and all those things. You can't expect to do those things efficiently if you don't have the shoulder strength or the core strength to be able to do it. So for all the development, you still need to make sure that you kind of go back to the start to make sure that all your bases covered, and then you go from there.
Yes, and as you said, everything is connected, yeah, and everything is on top of each other.
Correct. Because one thing I was learning too in school was, and it got asked at a job interview some years later randomly, but it was basically that the connection between speech, well, between feeding and fine motor. And it was basically that when a child learns to or has the ability to eat with a spoon and all of that, that's when they have the fine motor skills to be able to hold the spoon. So it develops the same really, which
Yes.
was, that was real cool to it.
Yes.
Okay. One thing I wanted to ask you though was for older children. So let's say preteens or not the first year of life kind of children, but for older kids, what is your role with older children? Do you see, 8, 9, 10-year-olds in your practice with developmental issues?
Most pediatricians see children up to age 18.
Okay, and what sort of things would you do, or what kind of things, or well, basically I just want to know what's your role for older children who might come to you later in life.
I see most of the kids that I see leave me at around age 5.
Okay.
When they have had most of their shots and so on. About half leave, and that's fine. The other half stay behind, and I see them up to 11 or 12 until they start big school. The main problem that I see in primary school is kids who are not doing well in school.
Right.
And again, parents want to know, so they come. The main reason why they come because the kids are not doing well in school is because the kids are hyper.
Yes.
And then one has to decide whether this hyper is normal or abnormal. And then whether it's from the environment that is causing it, or whether it's something intrinsically wrong with the child. And whether there's a disease associated with it. Because if the thyroid gland is overactive, you're going to be hyper. If it's underactive, you're going to be slow,
Right.
And there are all sorts, if you're not hearing well, if you're not seeing well, you're going to get trouble. Yeah, many children don't realize they're not seeing well because the child grows up not seeing well. So for the
so you don't know what's right.
I always give the story of my daughter. When she was 11 years old, we were at Panorama Finals. We were up in the back of the grandstand. A band came on stage, the band from Lavantil, and everybody stood up, and she stood up next to me, and we making noise, and I noticed her squinting. And I said, what's the matter? What, you can't see? She said, I can't see. And so I gave her, I can't see the name of the band, I gave her my glasses, and she said, oh, Desperados. And that's how I found out that my lovely 11-year-old daughter about to take SEA, and I'm a pediatrician,
Wow.
and pick this up. Because the other thing about kids, you see, they're so adaptive. They're so adaptable. They can't see well. They fool you into thinking they can see well. They can't hear well. They fool you. They lip read you. They body language you. And so all of these things need testing at some point in time. That's why at 5 years, for example, all children, and the government is doing this in many of their places, hearing test, vision test, and of course you need to see a dentist. Those are the 3 key things and you have to test these things. You can't just say the child hearing well, or the child seeing well. All children should legally have that right to have their senses tested. At least those 2 main ones. And then you have the whole problem of children with ADHD, and you have children who have specific learning disabilities and hearing disabilities and so on. All of which needs to be diagnosed, not by me. They have to go to the appropriate
Everybody kind of thing. I know one of the things, especially with some of the older ones I have now, and even some of the younger ones, and it's kind of to do with development. I have a lot of parents who might tell me, oh, suddenly the child might be a little more defiant or stubborn, or something is going on. And then I'm like, oh, okay, how old is he? And is like that 4 years old? which is an age normally when children are just testing you, and then it's also preteens. So I have to remind the parent that, you know, this is the kind of age for those things. So it mightn't always be the special needs that you're dealing with. It's just, this is an area of development that, you know, your brain changing and you have all these extra things on top of the actual special need to deal with.
Yes.
So it's not always.
Yeah, it's very difficult sometimes to decide, you know, but there are a good child psychologist, a school psychologist, or you know, educational psychologist can determine a lot of these things.
True. I know for me it's really hard to figure out what is just, you know, preteen behavior, and then what is actual, you know, ADHD issues that might come about,
So
and the child is really struggling.
Those things take a couple of months to come to a decision.
Agreed.
Parents need to know that, you see, because there's too much Hollywood. You go to the doctor and the doctor says, yeah, the child has so and so. Life is not like that. So take a little time.
Yeah, it takes time to get these things done. Let me get to some questions now, because there's a lot going on in the chats here. So let me see. One parent had said before that, you know, the doctor diagnosed epilepsy but not autism. How come? And I think we addressed that when we were saying that because there are so many different factors you have to consider, it's not always easy just to say, right, that's what it is. So I think that will kind of take care of that question, hopefully.
It takes a long time to diagnose autism. Epilepsy, the child has a fit. Everybody knows it's a fit. You do a brainwave test, it comes back positive, you have your diagnosis, you treat.
Correct.
Developmental problems take a long, long time. It's not like you have a cold or you have a cough or a rash and you go by the doctor and you see the rash, you know what it is. These things are not like that. My boxer is barking. She wants to go outside.
Well, tell her we almost finished. She could go outside.
I'm coming back.
Okay. One of the other questions, I'll just read it to you all until Dr. Bratt comes out. Or one of the things one of the parents are saying is that the wait and see thing, because it's hard right now to even get an appointment in the public system like Mount Hope, that's why wait and see becomes so difficult, because it takes so long to get things done that you end up waiting a whole year plus without getting any headway. And unfortunately, right now it kind of comes down to having to do everything privately, and this means having to go by one person for this assessment. And I know a lot of times parents might come to me first, and then when I say, well, okay, we have to do our initial session, and then they might say, oh, well, I did an evaluation already by the speech therapist or by somebody else. And I have to say, well, you know, great, I want to see it, but it doesn't make much of a difference with what I need to do, because I need to do different things. So it is really, really hard for parents to be able to I mean, financially is one whole other aspect, but also just to think, you know, I have to go here, I have to go here, I have to do this. And that whole first process of kind of getting everything to make up the diagnosis or getting everything for the first part, it does take a very long time to be able to go through the whole process before you get to a point where you could say, well, okay, where do we go from here? So you could understand why a lot of parents might just get over it and say, you know what, I'm not dealing with this right now, you know, I can't take it.
Absolutely.
Yeah.
It's too frustrating.
It is, unfortunately, and I know it's frustrating here with the way that our system is set up right now. We're working on changing this. I know plenty of us are working on trying to change.
Listen, 40 years ago when I began practicing, people like you weren't around, you know. There were no OTs, there were no PTs, there were no audiologists. Now we have, and a fair amount.
We
need much more. We need to organize, but it's better.
We do. I agree.
Ali, I just want to make a point
Uh-huh.
which people probably have picked up. There's no test for developmental problems. You know, like you
Right.
think you have epilepsy, you can do a brainwave test and you find out, or your thyroid not working and you do a test and you find out. And that is what makes it a lot frustrating, more frustrating for parents, because there's no test that you can do quickly and say, this is so.
Right. And that
So,
actually is answering one of the questions now, where somebody's asking, you know, what or who should she go to see to basically find out where on the spectrum her son is. And I think, I mean, you have the guidelines, like you have, oh, the name was just in my head and it came out of my head. But you have the guidelines that will tell you where on the spectrum you are. There's level 1, level 2, level 3. And in
right.
which level, the diagnostic and statistical manual, the DSM-5,
Yeah.
right? So there's a DSM-5 that could give you these guidelines and tell you, well, you know, if you have this certain social issues and if you have, you know, 4 or 5 points from this column and that column, you're here. But I think exactly as you tell you still need to rule out so many different things that you can't look at a DSM and say, oh, well, yeah, my child has all of those, so my child is autistic. It doesn't work like that.
I'm seeing some very good comments.
Yes.
Excellent comments. Obviously, people on this know what is going on. Yeah.
Okay, so one of the comments that's really good, somebody's asking about the thyroid test, because I know I hear a lot about thyroid issues and all that. I don't know much about it, but I know that thyroid issues could affect so many different things that look like other things. So what is that thyroid test?
Well, thyroid test is not a yearly test that is requested in general.
Okay.
Children with Down syndrome should have a yearly thyroid test. That's because they are more inclined for their thyroid to stop or not work as well as possible. So that's why you do that particular test. And there might be other situations in which you need to do a thyroid test, but it's not routine for everyone.
And the thyroid test, is that done by you, by pediatricians, or is that something that you do in hospitals?
Or the hospital or the lab. The lab does it.
Okay.
The doctor I may take the blood and send it off to the lab, or depending on the size of the child, they can go to the lab and the lab gives the test and does it. It takes about 5 or 6 days to get back.
Okay.
Yeah.
I never knew all of those things. I
mean,
guess I'm learning a lot today.
In school, for example, a 7 or 8-year-old who suddenly starts doing badly, that's one of the tests that you would do.
Okay.
Because again, if the thyroid gland is not working well, the body slows down, and that means the brain slows down. And you run into problems in school.
And again, you see, that's why we go to pediatrician first, because you get to rule out those kind of things before thinking of things like maybe ADHD or anything like that. It's important to rule out all those things.
So the child does have Down syndrome. Yes. It's one of the things you do, like you do the x-ray for the child's neck, the child with Down syndrome, to make sure that there's no abnormality in the back of the neck, because some children with Down syndrome have an abnormality, and if they do certain exercises, they can break their neck.
Right.
So
okay.
It's not a nice thing.
Because of low tone and that kind of thing, probably too.
Yeah.
Okay, somebody is asking about labeling children, and I think next week when we speak to the psychologist, this is one of the areas that we are definitely going to focus on, with that whole thing of maybe when or if to tell your child that they have a diagnosis, and talking about labels and that kind of thing. So that question about the labeling, that's something that I know we're going to get more into next week. And I have my own thoughts on that too.
Yeah, it's I don't like it in general, but sometimes it gives relief to parents, because then they know what is wrong. You have a diagnosis.
Correct. I mean,
and then there are other things, like if you applying for disability grant in Trinidad, you don't get it unless your child is labeled severe.
Yeah. You need to have some kind of diagnosis.
If it's mild or moderate, they don't give you anything.
Correct.
Baldersing wrote about that in his letter today.
For insurance.
Yeah. Yes.
There's
Yes,
a
it's
question here.
about different pediatricians. Yeah. My advice always is get one pediatrician to organize everything.
True.
It's always better if you can do that. It's always better. If not, you have a little pulling here and there. Pediatricians do things slightly differently. Most we do it all the same, but there are slight differences. And that can confuse a parent who's already maybe confused when they have with a problem.
Well, it's the same thing for therapists. I totally agree too that some parents might have more than one OT, for example. And I know in situations like that, I have said, well, look, I don't want to share the child because we do things differently. Although I know for one of my children, she had different OTs, but it worked out well because we would always do things differently. So one would see her on the floor and then I would see her on the table. And I mean, that worked really well. But otherwise, I agree, just stick to one.
Yeah, it's better.
Okay, the last question is somebody's asking if, I believe is it the pediatrician could diagnose autism on his level. And I think we...
The only type I can diagnose autism because I'm not a developmental pediatrician.
Okay, so it's developmental pediatricians are generally the ones to say definitively.
There are two in the country.
Yes. Yeah. Those are the two that I know.
So it's better you go
the levels as well.
Sorry?
They give the levels as well.
I don't know. I would think so. I would think so.
And not because normally I'm so accustomed to just hearing, autism or whatever the diagnosis is. I don't know if I hear too much about the level, although it might be, or even with maybe some psychologists, if I get a report, it might say, high functioning, or he does give the levels. Okay. Yeah.
Good. It's good to have people who know the answers to some of these questions.
Yes. Right. So, I mean, we went through a whole lot today. I know I learned a whole lot today that I really didn't know before about development that I'm supposed to know so much about. But this is why I like to have different people on, because this is your forte.
Yeah, well, I mean, last week I came on late, but it was so interesting to me too. You learn from everybody.
Correct. So I just really want to thank you so much for being on today and sharing your knowledge so freely. I know we're still getting a lot of comments and questions, but a lot of the things, some of the things we'll touch on later, like behavior, we'll touch on a few weeks later. Next week, when we talk about the psychology part, we're going to touch on the labeling and some of those things. And I really just want to say thank you so much for being here today. If there's anybody else who has any questions, let me know and I'll pass it on to Dr. Bratt. Yeah. If I can't answer, to answer the person who asked about Obligats coming in South, we have a branch in South. As of yet, we're changing locations, but we will be opening back very soon. But otherwise, if you need somebody right now, we have maybe about 3 or 4 OTs in South that I could send you to. Right. So thank you, Dr. Bratt, for coming with us today. Thank you so much, everybody, for being on for today. Next week, we have psychologists coming on. We have Alicia Hoyt who will come and chat with us. So hopefully we'll see all of you again next week. All right. Yes. Thanks so much.
Yeah. Bye.
Bye.